today a project that we did in Morriston Hospital, Wales. And it was basically on the use of EIDO leaflets in our head and neck ENT outpatient clinics. So our main aim was to improve the use of EIDO leaflets in the head and neck ENT outpatient department. A little bit background about EIDO Healthcare. So it's basically a company which has a collection of digital projects, which provides patients with essential information basically about any proposed treatment, procedure, or surgery that we are going to do on them. And it explains a little bit more about the benefits, alternatives, or complications of that procedure a bit more in depth. So they can take the leaflet with them at home when you consent them, and then they can read about it in much more detail. And the main aim of this was to reduce the risk of litigation and just improve the doctor-patient relationship and the patient engagement with the clinical consent so that they can make an informed decision for themselves. It also gives us a chance as a clinician to avoid any malpractice claims, which can be quite a distressing time for patients and the clinicians as well. So this was just an easy way on top of like consenting and filling out the form or writing in the notes to give them something to cover you for in case they come up with a compensation claim in future. So going back into the history, I mean, in ancient times or going into 1957, there was a case that was called Bolam versus Freehan Hospital Management Committee. So basically in those times, the doctors used to consent the patients and tell them only the information that they thought were the most useful to the patient instead of being more patient oriented or what they would like to know and considering their wishes as well. So back in the days, there was a patient in a mental health hospital who had electroconvulsive therapy. He experienced some violent convulsions, and as a result, he suffered from a fractured hip. Mr. Bolams then filed for a claim and said that they were failed to treat him in a proper manner and that they should have used muscle relaxants. However, I mean, coming to the conclusion of that case, it was denied and he didn't win the case. Apparently, muscle relaxants were not used that commonly back in those days. So that's how the clinician in question won the case. I mean, fast forward into 2015, we had another case called the Montgomery versus Lancashire Health Board. And this time around, it was a pregnant lady who had a problematic birth with her newborn. A vaginal delivery was attempted, but there was a 12-minute delay between the delivery of the head and shoulders, and her son developed on to have a cerebral palsy. This generated another litigation claim. Initially, she lost the case, but then the Supreme Court overruled the previous decision from the House of Lords. And since then, the laws around the consent has changed slightly. So it's become more patient oriented. There are only certain instances where you think you can hold information from the patient, and that would be either if you think the patient is at risk of deliberate self-harm, and the second would be if it's in any emergency circumstances and you don't have enough time to discuss with the patient or the family, or the patient is unconscious for some reason, for example, intubated in ITU or came in with a trauma on call and stuff like that. So it's quite become medical legal nowadays how to consent the patient, and if they come up with any complications, have a thorough documentation and stuff. So that's where the EIDO leaflet comes and help us more to save ourselves from litigation point of view and just give a little bit more information to the patients. So what we did was we have introduced EIDO leaflets in our trust here, and then we examined the use of EIDO leaflets in our head and neck outpatient clinics, and then we just wanted to improve the use of it. So I'm not aware of any case that has been made against the department or anything. I'm just trying to say that we are just optimizing ourselves for future in case anything happens or something comes, so we are just well guarded against that. So the inclusion criteria were the only thing with EIDO healthcare leaflets are that we have healthcare leaflets for many of the surgeries, but then we don't have it yet for some of the procedures. So they were excluded out from the study, and only the patients who underwent procedures who had already EIDO healthcare leaflets were included in the study. We did a retrospective analysis back in the month of March. So the data analysis showed at that time that 89% of the patients that were audited had an EIDO healthcare leaflets, and we would expect them to be given to the patient. However, 11% didn't have, which were excluded from the study. So looking at how our performance was back in the month of March, 53% of the patients were not given EIDO healthcare leaflets. Only 29% of them were given, and the rest of 18% are those which might have been seen in the clinic, but they have not been initially consented. It's just they have been listed for the procedure, but they were expected to have another follow-up before the procedures, who would be expecting them to consent. So I further excluded that 18%, but the results were not that satisfying considering 53% of the patients had EIDO healthcare leaflets and were not given. So we then went on to implement them, emphasize it, spoke to the consultants, registrars, or the junior doctors who would consent these patients. And what we did was create a link on our hospital website where they can directly go and print it out. And we also made a nice booklet where you can have it pre-printed for every procedure, and you can just ask the nurse in the outpatient department to hand it over to you, and you can give it to the patient, just making it a bit more easier. And then we kindly requested all the doctors in the department to record that in their clinic letters as well, that it has been given, because once you give it to the patient, they take it away at home and they can always. So second cycle, just a few months later in the month of September, again, the data collection was the same. We just excluded patients who didn't have any EIDO healthcare leaflets for any procedure and just included the ones which had. Also excluded the patients with no clinic letter available or who would be listed out to be consented in the next clinic appointment. And this was all done in the month of September that just passed by. So again, looking into statistics of the cohort of patients which didn't have EIDO healthcare leaflets available were only 35% this time, and the ones that were available were 65%. So quite a huge amount this time. But further looking into the statistics, how well we have performed since the month of March. So we had about a 25% improvement of giving the leaflets out to the patient. So it's jumped up to 54% now, and we have reduced the amount of not giving by 25% as well. So overall, there's been a huge improvement. I think there's still space for improvement in the days to come, and we have raised that issue, but I think we'll sort it out. There are more, the 33% that were not given out would be more of a procedure. For example, if it's a procedure in ENT like laryngoscopy and then plus another, plus another, plus another. So you might as well have an EIDO healthcare leaflet for laryngoscopy, but not for the bits and pieces that you are doing extra. And you can always face litigation against that. So one way would be just explaining all the benefits and complications in your clinic letter and say, look, the EIDO leaflet is not available for this procedure, or get back in touch with the company who's dealing with these leaflets and able to provide it. So I think there's still room for improvement, but it's not that they were available and we haven't given out. It's more of like a gray area zone, but we have still improved quite efficiently, which is good. So the lines of actions are the same again. We just keep providing leaflets to the patient in hand. We keep documenting in clinic letters. Of course, when you are a medical practitioner, you know whatever is not documented is not done. I've essentially attended these clinic appointments myself, and they've been given out. But sometimes if it's a complex patient or you're writing a detailed clinic letter, you might just lost words and not say it in your clinic letter. So you just need to be more well with it. Whatever is not documented is not done, unfortunately, in the medical world. So we just need to improve more on that. And then we'll just re-examine the use of EIDO leaflets in a few months' time again and see where we stand. So just some food for thought. Of course, the freedom of information data gathered post-Montgomery case, the lady which had a difficult vaginal delivery. There was some auditing done after that in 2015, and the hospitals which used EIDO library for documents paid out 25% less on consent-related litigation than those who did not use the library. So I think it's quite a nice thing to have, and if you can minimize the risk of facing unnecessary tension, why not?